Welcome to another edition of the program Health Plus on Supreme FM 96.1, a program where we discuss different health issues in order to help us live healthy lifestyle and also to know what to do if faced with any health problems. I am Hadiza Isa. Today on the program, we will be talking about cervical cancer, its causes and early symptoms, and how it can be prevented. Cervical cancer or cancer of the cervix begins on the surface of the cervix. It happens when the cells of the cervix begins to change to precancerous cell. Cervical cancer is the fourth most common cancer among women globally. Let's hear from people on the street on what they know about cervical cancer.
All I know is that cervical cancer is the cancer of the cervix. Once you get to a certain age, they are prevented. Where you go for tests and do pap smear, because I've done it, and then the results will, I think you do it when you are 30, after every other 10 years. That's all I know.
This is the first time I'm hearing the name. I don't even know anything about cervical cancer.
Honestly, about it, I heard of it before because many people are suffering about it, about the cervix cancer, but they don't even know they have it unless you go for checkup. That's when you told if you have it or not. And I know that people should go out and check themselves about the cervical cancer. You might have it not knowing that you have it, but if you go and you check yourself, that's when you will know. If you have it, then you just proceed on the treatment before it will even get to.
Well, not small. What I can say is it is a disease that has to do with the female. That's what I can say.
I don't know anything about it. I have heard about the name, but I don't know what it means.
That was response of people on cervical cancer. Let's go for some musical break. You're still listening to Health Plus on Supreme FM 96.1. Talking about cervical cancer, let's link up with Dr. Fatima Aminu Mahmood, a gynecologist with Ahmadu Bello University Teaching Hospital, Shika, Zaria. Listen up.
Okay, what can you tell us about cervical cancer?
Cervical cancer is actually an abnormal growth that occurs in the mouth of the womb. And it's actually a very common cancer, particularly in our environment. It's the most common cancer in women after breast cancer. It is also one of the most common causes of death from cancer in women, particularly in sub-Saharan Africa. The statistics are actually quite scary. It's said that in a year, more than 500,000 women die from cervical cancer, 90% of whom are from sub-Saharan Africa.
What causes cervical cancer?
Interestingly, cervical cancer is actually one of the preventable types of cancer. It's said to be preventable because the cause is known in more than 95% of cases. And the agent that is implicated in cervical cancer is a virus called human papilloma virus. It's implicated in more than 95% of cases of cervical cancer. And for that reason, it is stated that if human papilloma virus could be prevented, then cervical cancer could actually become a thing of the past.
What are the early signs of cervical cancer?
The early signs of cervical cancer include abnormal bleeding, particularly if the woman is in a reproductive age. If she has any abnormal bleeding that is not typical of her menses, then it should arouse suspicion and it should prompt further evaluation. Another manifestation of cervical cancer includes bleeding, particularly after intercourse. Any woman that experiences bleeding after intercourse should present to the hospital for evaluation. Third presentation of cervical cancer is bleeding in a woman that has already stopped menstruating, so a woman that is already postmenopausal. If a woman that has stopped menstruating, that is notice abnormal bleeding, she should present to the hospital for further evaluation. Still yet, there are some women that could continue to have abnormal vaginal discharge, which they attribute to common infections or even poor hygiene. However, any infection that persists, particularly after evaluation and treatment with common antibiotics or other agents, we should prompt further evaluation to check for possibility of cervical cancer.
At what age can one get cervical cancer? Does it have any specific age range?
Yes, actually, women that are much older. It Incidentally, particularly in our part of the world, most women that have cervical cancer are actually in their mid-30s and early 40s. For this reason that any woman that is sexually active and is more than 25 years of age needs to have avail herself with opportunities for screening for cervical cancer.
Okay, what are the complications of cervical cancer?
The complications of cervical cancer are actually quite numerous. By the time cervical cancer becomes advanced, which unfortunately is the typical scenario we see in our hospitals in sub-Saharan Africa, the disease has already taken its toll in her body. At that point, in most instances, the kidneys have already been affected, and the woman will need either surgery or sometimes even dialysis for kidney function in order to have her blood filtered. Some of them in advanced stages continue to have persistent pain, and they may have to rely on strong analgesics to treat the pain at that stage. Some continue to have persistent bleeding, and they may need recurrent transfusion because of that complication. And these are just a few of the complications of cervical cancer when it presents at an advanced stage.
Okay, how can we prevent cervical cancer?
Thank you very much for that question, because I think that's perhaps the take home with cervical cancer. As I stated earlier, it is one of the preventable cancers, and it is for this reason that even the WHO has initiated a call to action and a global initiative for the prevention and the elimination of cervical cancer. It's called the 1970-90 target by 2030. And it is a holistic approach to ensuring that cervical cancer is actually a thing of the past. The first 90 of the 1970-90 goal is to ensure that at least 90% of our women, the girl child, gets vaccinated with human papillomavirus vaccine. That is the virus that I told you earlier is the cause of cervical cancer in more than 95% of cases. So this goal targets that at least 90% of girl children before the age of 15 get vaccinated with human papilloma vaccine. It is actually a 2-dose or sometimes 3-dose vaccine that is given to girl children even before they start to engage in sexual activity. The second arm of the goal is the 70 goal. This goal ensures that women get screened for early stages of cervical cancer or even before it becomes cancer. It involves the use of screening programs like the use of a test we call pap smear, or sometimes the human papillomavirus testing for women at the age of 35 years, and then a second screening that is done at the age of 45. This is all in an effort to detect the cancer even before it becomes cancer. The good thing about cervical cancer is there's a prolonged period before from getting infected with human papillomavirus to coming down with cervical cancer, sometimes up to 20 years. And in that period, if the woman gets the opportunity to get screening and these precancerous lesions, as we call them, are detected, treatment can be put in place and the patient can become healthy again. That is the 70 part of the goal. And then the 90 part of the goal ensures that any woman that is screened and is found to have what we call a precancerous lesion, that is cancer before it has become cancer, then she should get complete treatment. And also, women that already have the cancer, it targets that 90% of these women should actually have treatment and sometimes palliation that is going to be detected as an advanced stage. They should have all the support they need so that they continue to enjoy pain-free life. So that is the 1970-90 goal that is advocated by WHO by 2030. And the aim is to ensure that by 2030, cervical cancer is eliminated. Elimination is said to occur when we have less than 4 women in 100,000 women coming down with cervical cancer. We pray that we get to that stage.
What general advice can you give to the listeners regarding cervical cancer, as this month is World Cervical Cancer Month?
So the general advice, we have to start with stakeholders, the government, and our religious leaders as well. They are all stakeholders in this matter. We need to call on the government to ensure that the human papillomavirus vaccine is incorporated into the vaccination schedule for children up to the age of 50. That would go a long way in eliminating cervical cancer in our environment. Religious leaders also have a role to play to advise our parents to ensure that children get this vaccine even before they become sexually active. Other health measures include generally ensuring a healthy lifestyle, avoiding smoking, avoiding sexual promiscuity, and being faithful, and the use of condoms when it becomes necessary. All these help to reduce the burden of cervical cancer in our environment. We also need to strengthen our healthcare system such that we have provision for both screening and diagnosis and even treatment of cervical cancer whenever they occur. Any woman that has normal vaginal discharge should not conclude that it is just an infection and continue to take over-the-counter medication. Try to come to the hospital and get proper evaluation. Let us try as much as possible to encourage our women to have at least a pap smear to screen for cervical cancer. This goes a long way in preventing cervical cancer amongst our women.
Thank you, Dr. Fatima Aminu Mahmood, for enlightening us on cervical cancer. Let's make sure we take the vaccine, and whenever you experience any symptoms, go to the hospital for checkup so that we can end cervical cancer. This is where we've come to the end of the program, Health Plus on Supreme FM 96.1. Special thanks goes to Dr. Fatima Aminu Mahmood for her contribution, and to the producer of the program, Abida Adamu. Keep a date with us next week, same time, same station. Live healthy. I am Hadiza Isa.